Good morning. Today, what I wanted to do is just go through some of our presentation slides to give you a little background for anatomy. Maybe it will help you along the way. The first time that people started to study anatomy or the human body was to treat illnesses and injuries maybe occurred at someone's house. Maybe they slipped, tripped, or fell. Maybe they had some type of wound from a war or something like that. But they tried to figure out how to treat people with these illnesses or injuries. Many used different types of herbs and lotions, oils, things like that. They used magic, they used different superstitions. They might have sang all of those things to treat the human body. But some of them worked. Most of them, of course, did not work. Eventually, the study of medicine came around. They needed to use more of a standardized language, and they used Greek and Latin words in order to begin this study. Anatomy is actually the study of the structure and shape of the body and its parts, also called morphology. What I say anatomy is, it is what are things called. And so if you point to the arm, you can say, well, my arm, the upper part of my arm, the muscle on the upper part of my arm is the bicep brachii, not just that thing. All right? And so we're talking about what is each part called. The humerus is the bone of the upper part of the arm. When I'm starting to look at things even more closely, other words come up, and that's called anatomy. Physiology is the study of how the body and its parts work and function, or how do they do the things they do. So when I'm looking at anatomy and physiology, they go kind of hand in hand, because if something looks a specific way, then its function is because of the way it looks. We'll get into that more when we start looking at the exact way muscles and bones are used, and how the lower part of my arm is pulled to the upper part of my arm when I'm trying to go touch the shoulder. Those are all functions of the way it was built. Anatomists rely on observation, dissection, which is actually the cutting up of things. So we're still looking at things, while physiologists employs experimentations, where we are looking and we are searching, we are experimenting. How is this working? How does that do its job? Now, it's more common to discover new information about physiology, but anatomical discoveries are being made as well. They're not as big as physiology, but they're still there. Both are being discovered. We also have an idea of gross anatomy, and gross anatomy is not where you go, ew, that's gross. No, it means big anatomy, stuff that I can see. They're large structures, easily observable. I can see that bone. I can see that blood vessel. I can see the heart. I can see, in this case, the liver, the stomach, the intestines, even the little green gallbladder in this picture. I can see those things. Microscopic anatomy is small structures, things that I can see with a microscope. So when I'm looking at this picture, this is a picture of cells in a human's stomach. I can look at it even closer and see, well, how do those cells look on the microscopic scale? Now, we're not going to have time to talk about the levels of structural organization. We have talked about those in your regular biology class, but all that this means, and this slide is talking about, is, well, we start from the atom level. Those are the we can even go further. What are atoms made out of? Your nucleus, and your that has your protons and your neutrons, and your outside of that nucleus is your electrons, and how many protons and neutrons. But we're talking there as those things get together, and we can make chemicals, molecules, And then a bunch of molecules get together and they might make a cell. A bunch of cells get together and start doing something. I got a tissue of all those similar cells. And then I have a bunch of different cells come together and I make some type of organ. Then I get a bunch of organs together. I have an organ system. And all of those organ systems working together, I have the organism. That's what we're talking about with this slide. I'm going to fast forward through some of these slides. You'll be able to look at those. Those are all different types of organ system that we will try to get through this year. Now, when I'm looking at these pictures, I wanted to talk a little bit about some of the things that you might have heard about with anatomy. These are all, well, two of these pictures are Michelangelo's, and two of these pictures are Leonardo da Vinci's. Now, Michelangelo, he has the ones on the left-hand side, and those pictures of the hand and of David, both of those are from his statue of David, kind of show his very strong interest in anatomy. Both Leonardo da Vinci and Michelangelo dissected cadavers, which are dead people, and they participated in this to learn about the human body. Leonardo da Vinci actually went farther, and you can see his Mona Lisa picture there at the bottom. And then up on the top, you can see one of his drawings, sketches, and some of his notes about that human body. This is Andres Versluis. You've seen a couple of his pictures so far today. And Andres Versluis was this really good artist. I like some of his works, although some of it's very macabre and dark. But he is this physician who dissected the human body and described what he saw and helped correct some misconceptions about the human body in the time that he lived. He wrote a book called De Humani Corpus Fabrica. I think that's how you pronounce it. But that is the human corpse, or the outside covering of the human body. I love the way he put that. Here's a great picture here showing the Leonardo da Vinci sketch, and we still use this for the most part in our anatomy. And this is the anatomical position. I'm going to talk about that today. Anatomical position is the proper position that we look at the human body. Every time that we are talking about the human body, we assume that the human body is in anatomical position. Anatomical position is where you're standing erect. You can see this girl here is standing upright. Her feet are a little bit apart, pointed forward. Her arms are at her side. The palms are out towards the front, and her thumbs are out towards the outside. All right. So as you can see, she is looking forward. She's standing straight up. Her feet are pointed forward. Her hands are at her sides, and her palms are facing towards us. You can see the person on the right there. He is also showing anatomical position, although we are seeing him from his side. Now, where we always get confused in anatomical position is a saying that I say, they're right, you're wrong. Meaning, when I'm looking at this girl here, I am looking at her right and left side. Her right and left side are my left and right side. Meaning, if I have my right hand up, and I don't know if this is opposite on the video here, but if I put my right hand up, my right hand is actually her left side of her body. So something that I want you to think about, because this is going to get kind of confusing for you on some of the exams that we're going to have in here. Remember, they're right, you're wrong. We use special terms to decide what is up and what is down, what is to the left, what is to the right, what is further away, what is closer, what is towards the front, what is back. So all of these have special terms that you need to learn in order to understand anatomy. Now, I did put a video down that you will be able to look at, and he does a great job, Mr. Ford, of trying to figure out how do we talk about some of these things. And I'll talk about it in class too. But one thing that I want you to think about is the more that we talk, the more that we are going to use these terms. Now, before, I was saying it towards the up and towards the down and towards this side, towards that side, and further away. I'm going to switch now and only use the terms of anatomy. I want you to do the same things. In class, if you say, hey, Mr. Ells, what's on top of that? I'll say, I don't know what you're talking about. What is on top of what? Well, you'll say, well, on top of the heart. I'll say, on top, what is on top? Your answer is, well, what is superior to the heart? Those are the things that we're going to talk about now. Now, when I talk about superior and inferior, I'm saying, well, what is on top and what is on bottom? Here's the example. My forehead is superior to my nose. My forehead is on top of my nose. My head is superior to my shoulders. Now, the opposite, I could say, my nose is inferior towards the bottom of my forehead. My shoulders are inferior to my head. Anterior and posterior. That's how we say towards the front or towards the back. Now, I want to tell you that we are, and now you know, we walk on 2 feet. We also can say ventral and dorsal here. If I was quadrupedal, 4, or like a dog walking on all 4 feet, I would use some different terms here because ventral and dorsal actually is my belly and my back, but that's only in the quadruped. So if we're in anatomy and we're talking about humans, these 2 things are interchangeable. So anterior, that means towards or at the front of the body, in front of. The breastbone, all right, that's that little thing right here in the middle of your chest, is anterior to my spine, right, that backbone. My nose is anterior to the back of my head. Posterior is towards the back. So, little got confused there. So posterior is towards the back. My heart is posterior to my breastbone. The back of my head is posterior to my nose. Now remember, I can use these 2 things interchangeably. Or I could say my heart is dorsal towards the back to my breastbone. The back of my head is dorsal to my nose. Medial and lateral. Now, one of the things that I want to talk about, and we are going to be doing this a little bit later, is learning the planes of the body. And one plane is called the sagittal plane. Actually, I do it right in the middle. It's called the mid-sagittal plane. And so I'm thinking about a line right down the side of my body. With medial and lateral means going towards the middle. Lateral means going towards the outside. So medial, towards or at the midline of the body or on the inner side of something. My heart is medial to My arm. My heart is towards the middle of my arm. My heart is medial to my nipple. My belly button is medial to and superior to my hip. Well, I can use two of those. Lateral means away from the midline. So my arms are lateral to my chest. All right, they're towards the outside. Intermediate, proximal, and this one, distal. Now, I'm going to talk about intermediate, which means in the middle of two different things. But proximal and distal are hard for students. Right? Proximal and distal. I know that this can be confusing at times, so we're going to spend a little bit of time with this one. First, when I'm dealing with proximal and distal, I'm looking at the point of attachment. All right? Here it says, close to the body or the origin of the body part or point of attachment of a limb to the body trunk. If you look at the Mr. Ford video, he does a great job of talking about how your arm or leg grows. Your arm or leg grows from your body out. All right, from your body. It starts here and it grows out here. Well, that's how we know this is the point of attachment. This is where it's attached, right here. That's where my arm's attached. So this is, if there's a point that's closer to here, it's proximal. If it's further away from here, it's distal. But it all depends on where it is. All right. So if you look at the example here, it says the elbow is proximal to the wrist, meaning my elbow, let's see, I got to get in the camera here. My elbow is closer to the point of attachment than my wrist is. So my elbow is proximal to my wrist. My bicep is proximal to my elbow. Oh, wait, you said my elbow was proximal. Remember, it's how I use it and what two terms that I'm using it for. My bicep is closer to this than my elbow is. So that's proximal. Then my bicep is proximal to my elbow. Let me use a different one. Get over here, distal. Distal means it's further away. So I could say, using my arm again, my elbow is distal to my bicep. My elbow is further away than my bicep is. My wrist is distal to my elbow. Well, you said the elbow is proximal again. Well, again, it all depends on how I say those two words. All right? Watch on my test here and look very closely at how do I use these words. And that will be a big indication for you. All right? Here, it says my knee is distal to my thigh. Yes, my knee is further away from the point of attachment of my hip than my thigh is. My thigh is very close. Superficial and deep. Superficial means closer to the skin, all right? Closer to that outside, that body surface. Deep or internal means further inside. Think about it like this. If I go outside and I scrape my knee on the pavement because I fell, I'm going to need a Band-Aid, all right? Because I just kind of scraped that skin. It's not very deep. It's just a little bit of scratch. I get a little bit of blood, not a big deal, all right? That wound is superficial. All right? Here, the skin is superficial to the skeleton. The skin is on the outside. Right? I could even say the muscles are superficial to the bones because the muscles are on top of the bones. A deep wound would be something like you got cut. All right, we were that case study. Somebody was cut with a knife, carving stuff. You are going to need to go to the hospital and get stitches. Right? And so those things are deep. You have now wounded further in of the body. The lungs are deep to the rib cage. So my ribs are superficial to my lungs. They're closer to the outside of the body, while my lungs are deep to my ribs. Now, how do we cut up the body? How do we section it to look at it in different ways? I love these pictures, as these pictures are going to be some of the questions that I'm going to give you in a little while. Or I should say on your quizzes and tests. So we have the first one here. This one right here. We're going to cut the body. In a class, I do a whole samurai sword thing. But if you're standing right in front of me, we are face to face, and I'm holding a sword, and I go and I cut you from the top all the way down in a straight line. That's called a sagittal section. Right? Divides the body in right and left portions. Now, if I do a great job and I do it right in the center, absolutely, boom, dead on, then I've done a special cut, and we call that a mid-sagittal section. I could miss and go, well, right, just cut off this part. That's still a sagittal section, but it's not a mid-sagittal section. So mid means middle, right there in the midline. All right, sagittal, left and right. A transverse section is if you are standing to my side, and I take my samurai sword, and I cut down, and half of you falls forward, and half of you falls backwards. That's called a coronal or frontal plane. Right? Think about frontal as toward the front. Right? I sometimes joke in class, a Corona, a beer, you drink with your mouth, and that's on the front of your body. So a coronal plane cuts the body from anterior and posterior. Now, there's not a mid-coronal plane, right, like the mid-sagittal plane, but I can cut the body in different sections. They don't need to be equal to be coronal. Just has to cut the body between the anterior and posterior, or ventral and dorsal sections. The last section that we are going to talk about is the transverse plane. Many of you think of this as a cross section, but in anatomy, we call this a transverse section, of course, because we are using an anatomical terms. So what that is, if you're standing in front of me or to my side or wherever, and I take my samurai sword and I cut you in between superior and inferior sections, or top and bottom, I cut you like that. That's called a transverse plane between superior and inferior. Now, again, there is no mid transverse section. All right. So I could cut myself off here, just on my chest, wherever. And you can see these different planes as they are. All right. It's cutting right through the belly section. All right. There's my liver there. This one, I have my coronal section. Right? You see the two shoulders and the lungs and the heart. And here is my sagittal section. Probably a mid-sagittal section, because I see the full area of the nose. I see the spinal cord. So we're probably a mid-sagittal section on that. Here are the pictures one more time for you. Another way that we look at anatomical position is if the body is laying down. And how is it laying down? Is it laying face up, supine, or laying face down, prone? All right, so we still are using those same types of anatomical areas. All right, prone, we have those body still in left and right. All right, they're right, you're wrong. But supine, face up, prone, face down. Your body has different cavities. We have let me stop. Ooh, I'm looking at the wrong slide here. Okay. Your slide is your body is divided into two portions, your appendicular and your axial. Think of axial like axis. So an appendicular means all of the stuff that is attached. So your arms and legs, all right? Your upper and lower limbs. That's your appendicular. Your axial, your axis, is your head, neck, and trunk. Right? So your axial, head, my neck, and my body, my appendicular, my arms and legs. All of the organs are in these cavities, and we call them viscera. That's all the viscera. You might have watched a horror movie or read a book with somebody that eviscerated someone. And that means that they cut them and their organs fell out. Kind of gross. Here are your two body cavities. I have a ventral body cavity and a dorsal body cavity. My dorsal body cavity contains viscera. I have my head or my cranial and my backbone or my spinal cavities. My cranial cavity contains my brain. My spinal cavity contains my spinal cord. My ventral body cavity, remember that's the one towards the front, contains my thoracic cavity and my abdominal cavity and pelvic cavity. I sometimes crunch those two words together, abdominal cavity and pelvic cavity, and call it my abdominopelvic cavity. My abdominal pelvic cavity and my thoracic my thoracic cavity are separated by what's called a diaphragm. And your diaphragm is a muscle of your body that you do not have a voluntary control over. You probably played with it when you got the hiccups. That's a spasm of the diaphragm. And the diaphragm helps you breathe. You're a negative pressure breather. We'll talk about that when we get into our respiratory chapter. Again, our dorsal cavity is divided into our cranial cavity and our ventral cavity. I won't go through all of this stuff, but you will need to read this as we go through. The only thing I did not talk about is the mediastinum. The mediastinum is in the thoracic cavity, and that divides the thorax between right and left halves. There are other smaller cavities in the human body. You might have heard about the nasal cavity. I mean, if you've had sinus infections, that's an infection of your nasal cavities. Your orbital cavities hold your eyes. The middle ear cavities hold different organs and bones that help you hear. Of course, your oral cavity is where you throw in that pizza. Our abdominal pelvic cavity is divided into quadrants. These are pretty easy ones, but you remember, you're remembering they're right, you're wrong. And so if you look, if you can see my stuff here, here's my upper, right upper quadrant, my left upper quadrant, my right lower quadrant, and my left lower quadrant. Those contain specific things that doctors will use in order to figure out what's going on with you. A little bit further with that, you might have been to the doctor to get a physical recently, and the doctor might have taken his hands and palpated your stomach. Ooh, gross. What is that? Palpated. Oh, no, he never did that. Yes, he did. Or she did. That means that they took their hands and felt different areas of your body to see if you had pain in some places. They did this probably 9 times for each one of these different regions. We have the right and the left hypochondriatic regions, the right and left lumbar regions, the right and left iliac regions, the epigastric and the hypogastric, and the umbilical region. How in the world am I going to remember this? We'll talk about that in class. My ideas. You ever been in a car and they have a nice lumbar section of that front seat? That's that middle back section that you can sit on. Gastric means stomach or where you're digesting stuff. Epi means above, hypo means below, and so this is above region, this is the below region. Hypochondriatic, and iliac. One of the ways that I remember this is that H comes before I. H is on top or anterior to my, superior. Man, I'm getting those mixed up this morning. H is superior, comes first before the iliac region. That's how I remember those things. Umbilical, everybody remembers the umbilical region. Let's face it, we all have a belly button, except one of my friends, which is kind of a weird story. All right, so we're not going to talk about body landmarks today. That's where we're going to end up. Hope this was helpful. If it wasn't, sorry, I'm trying my best here. And we'll talk more in class. Hope this helps.